see I wasn't recording. You only see a couple of fields. You only see maybe community or hospital, or now, you know, GP a little, but these pharmacists have broken through into different fields, and hopefully it will all inspire you to see where pharmacy can take you, and to know that the world of pharmacy is much bigger than you might think. So our first speaker tonight is Megan Jones. Unfortunately, she's not been able to join us to speak live right now because she's having a problem with a cough. So, but she's kindly made us a video, which we'll play, and she'll join us for a Q&A session after her video. So just to tell you a little bit about her, she's a lead nutrition pharmacist at Cambridge University Hospitals NHS Foundation Trust, and she's been so for the past 3 years. She was also awarded Best Clinical Pharmacy in Day Lewis when she used to work there. And yeah, so she's produced a narrated PowerPoint for us, and she'll join us for the Q&A session. So if you have any questions, please feel free to leave in the Q&A chat, or put it in the main chat, and we'll get to that after her talk. So again, thank you everyone for joining, and I'll play her video.
Hi everyone, my name's Megan Boucher and I'm the lead nutrition pharmacist at Cambridge University Hospitals. I'm just going to have a quick chat to you guys today about my career so far and how the MPharm degree helped me get to where I am, and there'll be a chance to ask any questions. So I'll start at the beginning of my career and how I decided to do pharmacy at university. So I actually just wanted to work in a hospital. I'd witnessed multidisciplinary team working whilst visiting a family member on the ward. So you can see the nurses, the doctors, physiotherapists, OTs, pharmacists all working together to get a positive outcome for the patient. And I really liked the idea of working as a team. And also I do take joy in helping others. So I kind of really wanted to work in a hospital. I enjoyed the maths and sciences at school, and I spoke to my dad about this, who has a background in the pharmaceutical industry, and we kind of decided that I should study pharmacy at university. So I started my MPharm degree in 2014 at the University of Bath. During my degree I really enjoyed the clinical units and also the pharmacokinetic units. I went to the University of Copenhagen to complete my Year 4 research project, which was on electrospinning of nanofibers, which was quite interesting and very different, and that was for drug delivery. So I published that paper, and it was a really good experience to kind of understand what is involved in publishing papers and how to write kind of scientific papers as well. During my degree I also won the Day Lewis Award for Best Clinical Pharmacy, and that was at the end of my degree. And that was for getting the best mark in our 4th year exam for clinical pharmacy. And this kind of highlighted to me that, you know, the clinical pharmacy was what I really enjoyed and what I was good at, and made me want to work in hospital, you know, even more, because I felt like this is where I'd use my clinical pharmacy knowledge the most. So I applied for hospital trainee posts through the Oriel trainings Oriel application system, and I managed to secure my top choice, which was Cambridge University Hospital. So I started my trainee pharmacist year at Cambridge University Hospital in 2018, And during this year, I really solidified my clinical knowledge, which I learnt at university, by applying that to real patient scenarios. And it was really interesting to kind of see everything we'd learned at university and then see it in real life. And if things aren't, things are more complicated in hospital and you're not necessarily always following guidelines, you have to maybe take a part of one guideline and take part of another guideline, and because patients don't always fit into kind of clinical guidelines. So it's really interesting to see how that kind of worked in real life. I also developed my consultation skills, taking medication histories, needed medicines reconciliation, doing discharge counselling and complex medication counselling. And although we'd practiced in OSCEs and with actors at university, it was very different in real life, kind of talking to patients. And you then understood why at university you were told to do certain things in your consultation. For example, creating a shared agenda or at the start of your consultation. That was so important in real life, because if you don't kind of set out what you want to talk about at the start of the consultation, it's very easy for the patient to get quite sidetracked and confused about what you're there to talk to them about. So it kind of all came together at university in terms of like developing my consultation skills. And even now I'm still developing those skills, because it's kind of an ongoing development. You can always improve in your consultations. I also completed an audit during my training year, which was brilliant because we'd learned about it at university, but it was great to do this in practice. We also did a 2-week community pharmacy placement, which obviously responding to symptoms over the counter. Great knowledge from university, which I used in this placement. And I did a CCG placement, which is the clinical commissioning group. So they kind of commission medications for primary and secondary care. So you learn about, why certain drugs get funded and why some don't, and all the processes behind the scenes, which was really interesting and has been really useful in my future career. And obviously we use this year to prepare for our exams to qualify as a pharmacist. So luckily I passed my exams and started my career as a pharmacist in 2019 as a resident pharmacist at the same hospital as CUH. So this involved doing on-call shifts, being the sole responsible pharmacist in the hospital overnight, and that was a lot of problem solving, decision making, learning on the job. Used a lot of clinical knowledge in all different areas, because you needed to know, how to manage children, transplant patients, oncology patients. So this was, helped me to learn very quickly. We also did shifts in the inpatient dispensary in the hospital, and I rotated on throughout quite a few clinical areas, a lot of surgical areas, which I took more of an interest in. I really enjoyed working in surgery because you can make quite a big intervention, because the wards are mainly managed by foundation doctors, as the kind of registrars and the consultants are in surgery. So you can make a really, really big intervention on patients on surgical wards, because less experienced medical professionals are on the wards managing their medications. During this time I also started studying at the University of Hertfordshire for my postgraduate diploma, which kind of builds on the university knowledge that you've already learned, but it goes into more detail in those clinical areas such as renal and hepatic therapeutics. And in 2020 I started my career in nutrition. So I had seen the job advertised, and I knew that the job involved multidisciplinary team working and also involved ward round working. So I took part in a weekly intestinal failure ward round, with working alongside specialist dietitians, specialist nurses and doctors. And we advise on PN regimes. So PN is parenteral nutrition, so nutrition which goes via the parenteral route, and this has to be used when patients can't have nutrition orally or enterally. So there might be, for example, bowel obstruction caused by cancer, meaning the patient can't eat anything have anything through their GI tract. So parenteral nutrition doesn't go via the GI tract, it goes parenterally through a special line. And you can have several different bags with different components in. So PN has electrolytes in it, so sodium, potassium, magnesium, phosphate, calcium. You can get different size bags, so you can get 1.5 litres, you can get 2.5 litres, you can get 4 litres. So we see all the patients who need PN or are already on PN, and we advise which regime they should have, so which bag they should have. We then order these bags from pharmacy where we have a special aseptic compounding unit. So I took part in that ward round on a Monday during this job, and then in the other mornings I covered the gastroenterology wards, kind of providing a pharmacy service, so discharges and ordering medications and doing medicines reconciliation. In the afternoons I would then release the PN for the whole hospital, so you've got your paediatric patients, your neonates and your adults, whilst assessing the stability and also stability of the actual bags and the suitability of the bag for patient. So checking bloods, so for example checking your potassium levels and making sure they're in range before giving a bag with potassium containing in it. We also during this job released aseptically made products such as eye drops, and took a large role in education and training other pharmacists, training resident pharmacists on how to deal with queries out of hours regarding PN, and also training our rotational band 6s coming through into the department on how to release PN, and also training on the clinical aspects of PN as well. So in November 2021, I moved up to lead of the service, so lead nutrition pharmacist at CUH. So it was the job immediately above my previous job. So as lead of the service, I took part in twice weekly intestinal failure ward rounds. I'll just go into a bit more detail about what's actually entailed in these ward rounds. So we work out patients' requirements for several different things. So calorie requirements, and we've got kind of different formulas to work this out depending on their weight and also on their clinical condition as well and their BMI. And obviously we kind of know a little bit about we work out BMI and things at university, so having knowledge of that was very important when starting off in this job. We also work out their fluid requirements, so that's all in the NICE guidance on how many mils per kg of fluid patients need per day. So we take this into account, and we also take into account their requirements for electrolytes, so sodium and potassium, calcium, magnesium and phosphate, and in millimoles per kilogram. There's NICE guidance on how much you should have per day. And also we work out their protein requirements as well. And using all this knowledge, we then try and fit them into a bag of PN to try and meet those requirements. So that's the patient kind of starting off on PN, and then if they're continuing on PN, we will monitor their weight, their electrolytes, their temperature, and fever kind of indicators, so white cell count and CRP. We monitor the other drugs that they're taking as well, and we'll monitor kind of their clinical picture, so if they're eating or not. And this will kind of help us make decisions on whether to continue their PN, whether we need to change formulation, or whether we can stop PN because they're now able to be fed enterally. That might be via the mouth or via some sort of tube, enteral tube, which would be like a nasogastric tube, or a nasojejunum tube. So that's kind of a little bit of a background on what we actually do on the intestinal failure ward rounds, and they're really, really interesting. And I guess the role as a pharmacist, I really take a good note of what drugs they're taking and make sure I identify any medications which might affect their electrolytes. So for example, an ACE inhibitor might increase their potassium. If that's been restarted and held off for a while and then restarted and their potassium's gone up, I could then advise the rest of the team that we should reduce the potassium in their PN bag to kind of account for this. So I always look out for medications which might affect electrolytes. Also looking out for medications such as diuretics, which might affect their fluid balance. So I've always got a kind of keen eye on the medication chart to see if there's anything that might affect their nutrition. I also attend multidisciplinary team meetings every week where we discuss several patients, so inpatients and outpatients. And if there's any kind of pharmaceutical issues, I can raise them, or if any of the healthcare professionals have any queries about medications, then I can kind of help with those. It's a really good opportunity for pharmacists to kind of be involved in the MDT and make a really big impact. I'm constantly creating and updating hospital policies in dietetics and intestinal failure to kind of make sure that there are policies that other healthcare professionals can follow. And I provide support for other pharmacists with any dietetic related inquiries as well. Education and training is kind of an ongoing part of my role. Training pharmacists rotating through PN, also now training the nutrition pharmacist, band 7 nutrition pharmacist in the department. I also help with training kind of the pharmacy technicians and support workers that work in the aseptic unit. And I also work with the new trainee pharmacists to keep up my knowledge on the wards, help them kind of learn how to do medication histories and things like that. Also, you need good time management skills to manage all the rotas and annual leave and everything that comes with being kind of a lead of a service, which I think you really do develop while you're at university, having to do all the revision and manage all your lectures and things. That's kind of been really useful in my career. And I've also worked really closely with the aseptic department to try and improve processes, but also we need to make sure we adhere to good manufacturing practice, which the foundation of my knowledge of good manufacturing practice came from university. I remember quite clearly learning quite a lot about it, and I wish I'd saved my lectures so I could go back and read them all. So definitely make sure you try and keep all your lecture notes for when you become a pharmacist, because you never know what might come in handy. So that is the end of my presentation on my career so far. I hope it was useful and interesting to hear about kind of a bit of a different career in pharmacy. What I would say is, don't be afraid to specialise. It's really interesting to have a really in-depth knowledge about kind of an area, because you can give more specialist advice out to other healthcare professionals. If anyone has any questions, then they can ask me in the Q&A. Put my email down here as well if anyone wants to email me any questions, or I'm on LinkedIn if you want to just message me. Thank you. I hope it was interesting.
Thank you for that, Megan. That was a really great video. So if anyone has any questions, could you please leave it in the chat, and she'll be able to answer you. I'm just going to make her a panelist. I see someone's raised their hand. I think for now we'll just say if you could just put any questions in the Q&A section rather than speaking, that would help.
Hello.
Hi, Megan. I've just made you a panelist, so hopefully you'll be able to answer the questions.
Yeah.
So if anyone has a question, please just pop it in the Q&A section or in the chat, either one. A question I have for you is, what made you want to go into nutrition?
I think it's kind of an area that people don't really know a lot about, especially pharmacists. But it was mostly being able to work as part of the MDT and doing ward rounds kind of as an integral part of your job role that I was interested in. So that's what first attracted me to the first post in nutrition. And then once I kind of started in that job, I didn't really ever leave. So that was what first attracted me. But quite nice to be a specialist in a kind of more niche area. I guess you can get into an area. So yeah, that's kind of what first triggered my interest.
That's good. And what advice would you give to students who are interested in going into nutrition pharmacy? And especially if they might be scared to, specialize. And
before I applied for the job, I shadowed a few ward rounds to kind of work out if I really would find it interesting. Because obviously if you want to go into like a specialist role, then you don't want to just apply for the job and start without having any experience. So I would say try and get some experience in the area and make sure that you actually will find it interesting, and then kind of go from there.
Thank you. And you said that you did a postgrad diploma. So did you find it useful for your current role or more useful for your previous one?
The postgrad diploma is quite broad. You do like certain clinical topics. We did do a gastroenterology topic, which was really, really useful because it goes into more depth than university, and we had it with specialist gastro and intestinal failure pharmacists who were quite experienced. So that was really, really useful because it's a smaller field. There's not many pharmacists kind of available at work to ask. In terms of the other units, they were really useful just to be a general pharmacist, because although I'm specialised, I still do generalist things at work. Like I still work weekends and I still support dispensary and do discharges for all of the different wards. So although I've kind of specialised, you never get away from the other generalist things as well, unless you worked, I guess, in a specialist hospital, because Addenbrooke's is like a large hospital with all the different specialities. I still get exposed to everything else as well, which is really nice. It's nice to keep up my knowledge in other areas too.
Thank you. And thank you so much for coming tonight. If there's any other questions, I'll tell them to send it to your email.
Yeah.
Thank you so much.
Thank you.
So the next speaker we have tonight is Omar, who is a senior prison pharmacist at Greater Manchester Mental Health NHS Foundation Trust, and he's been so for the past year. So I'm going to make him a panelist, and then he can tell us about his journey into pharmacy and into prison pharmacy specifically. And if you guys have any questions, please leave it in the Q&A section so you can answer after.
Good evening. Can you hear me?
Yes, you can, Omar.
Perfect. Well, thanks for having me on. It wasn't so long that I was in a similar situation to you guys. I was a student not long ago. So I started my pharmacy degree in 2012 and I graduated in 2016, and I'd done my pre-reg in a community pharmacy based in Manchester. And then I qualified in 2017. I stayed in community pharmacy. So after my pre-registration year, which is such an important year after your degree, I think is if you invest a lot of time in studying and using every opportunity to learn about the industry that you're in. So when you do qualify, when you start your career, you're ready for new challenges. So then after I finished my first year, I started locum in community pharmacy, and I continued to do that for 3 years. I worked across England, I worked across Wales, in various different stores, different companies providing different services, and I gained a lot of experience through dealing with different teams. Different areas of the country provide different services. So some areas in Wales are commissioned to do certain services. So we went out of our way to kind of be, complete the courses to provide those services in different areas. I was very keen on learning how each and every single community pharmacy company work. So I had a very keen eye on knowing, all the SOPs. So I could work in any company and I had no problem with it. Towards the end of my kind of locuming career, if you like, I wanted new challenges. So I was working literally in a different pharmacy every single day just to change things up a bit. I would go to a store, never been there before. It could, there could be no pharmacist for a couple of hours, and then you come in as the responsible pharmacist and ensure that the pharmacy is delivering the safe and effective service. So in 2020 of December, I thought that to do something else, maybe switch to work in the NHS. In some of the stores that I previously worked in, I worked in a pharmacy which had a high number of methadone patients. We had a lot of needle exchange. And then from that, it kind of sparked a bit of passion for kind of mental health, prison environment. And then an opportunity came in December 2020 to come in as a locum Band 7 pharmacist. So this was at HMP Wymont and HMP Garth. So I was the clinical pharmacist then. The main responsibilities of clinical pharmacists is usually along the lines of clinically screening prescriptions, ensuring that we are delivering a safe and effective services for the prisoners across both sites that I was working at the time. We ensure that the meds reconciliation is done within 72 hours of prisoners coming to the prison. So they could be coming from another prison, or if they've gone to an appointment and they've come back, another medicine reconciliation is done then to ensure any changes of medication. With the prison that I was at, so Wymont, it has an in-house dispensary. So we would ensure the dispensary processes are up to scratch. We would be working within a wider healthcare department. So we worked closely with the primary care nurses, the mental health nurses, the substance misuses team, the dentist, the GP practices, and the physiotherapists. So we were all one team. And prescriptions are a huge part of the prison environment. It's very different to community, it's very different to hospital, where we are in a secure prison environment. It's very different working there, to be honest, because I couldn't have my phone on me, I couldn't have my smartwatch. You come in with the bare minimum, because obviously due to the secure settings. Even when you go to the canteen, they won't give you a metal fork. So it was a bit different working there. However, so back to with it being in the prison, all the prisoners, all the patients, they have something called an in-possession risk assessment, which determines whether the patients are allowed to have any medication on them, or if they are classed as high risk, they can't have any medication on them. So the nursing team would be administering the medication. And then again, with it being a prison environment, there's certain drugs, no matter how low risk you are, you cannot have controlled drugs in your possession. For example, your CD2s, your CD3s, Zopiclones, and other medication like dihydrocodeine, due to the abusive risk and the highly tradable value of these medication. So we work on ensuring the clinical, when the prescriptions are done in time, they get dispensed, they get sent to the wings, and they're administered accordingly. So in the mornings, usually when it comes to the medicine administration phases, you have a not in possession morning administration and a not in possession evening administration. So your high risk people who are on BD dosing can be dosed in the morning and in the evening by staff. And when they're due their repeat medication, it's just like in a community pharmacy. When they're due the medication, they get called out and then they get handed their in possession medication. 2-3 months into the Band 7 opportunity, another job opportunity came up, which is to step up and take the senior pharmacist role. Although I was new to working at NHS, I think I had a lot of experience in the community pharmacy, a lot of transferable skills that I had as a locum, a lot of skills that I developed from being a pre-reg, and the passion that I had for patient care. It was the right opportunity for me to take and be in charge of both sites. So as the senior pharmacist there, the clinical pharmacist would be reporting to me. We would be working alongside the GPs, the consultant psychs, the mental health team. We would chair the medicine management meetings. So these are meetings where all of the healthcare team coming together, discuss certain areas relating to medicine. And with pharmacists being the expert in medicines, we would kind of lead and liaise all the issues medicines related. We also sit on meetings, so with the governors, with the prison themselves. So they're called local health delivery board, where there are meetings with healthcare staff, NHS England commissioners, the council and the prison, again, to discuss medicine related, not just medicine related, all healthcare related issues with the prison, and how the healthcare team and the prison can work together to improve patient outcomes. It's extremely different to what you'd expect to going to work every single day if you're in a community pharmacy or a hospital. But having said that, it's an extremely exciting role. In comparison to other areas of work, prison pharmacy has only been around for about 20 years as such, so the scope for development is huge, and that's one of the biggest reasons why I've stayed there. I think there is so much more pharmacists can do. And evidently speaking, over the last couple of years, we've seen how pharmacists have stepped up, especially with COVID, when it came to the vaccinations. The only places that were open were your supermarkets and your pharmacies. So what pharmacists can offer, not just in the community, but in the prison environment, in a niche environment, is significant. And again, working in conjunction with the consultant psychiatrist, your nursing team, your healthcare assistants. We all work as one team to deliver an effective service within a difficult environment, which can be challenging as such. We also work with the prison to ensure that people who are using illicit substances are managed correctly. So people who are using drugs such as spice, we review their medication, what implications are there. Also in prison environments, you'll tend to see people potentially could trade their medication. So again, ensuring that we are completing medication spot checks on prisoners based on suspicion, intelligence report we receive. And also a big area which I didn't expect when I first came into the job, was that we deal with a lot of HIV patients, a lot of patients on hepatitis C treatment. We also receive patients on chemotherapy treatment, because it's just basically the same kind of patient population in the community, but they're just in the prison. So liaising with drugs that we wouldn't really dispense in the dispensary, but outsource or be dispensed at the hospital. So ensuring that we are communicating with the hospital, ensuring that if they're on, for example, HIV treatment, they are receiving their treatment on time, liaising with the hospital for further supplies, dealing with Hep C nurses who come in, take the blood test, and work with their consultants to ensure that there's no stopping in their medication at all. So we ensure even medication that we do not dispense in the pharmacy, that are outsourced from outside, it comes into the prison and it's effectively administered safely in line with their risk assessment, which is such a bedrock in the prison environment when it comes to medicines. Recently, I've been offered the job to step up to be the lead pharmacist for the trust. So initially I was looking over HMP Wymont and HMP Garth, and in the next couple of weeks I'll be looking over 5 to 6 sites, across the trust, and just working to ensure that all the pharmacy processes are all kind of unified. And again, as pharmacists working in the prison, we are the experts in medicine. We're here to provide expert pharmaceutical advice to the medical staff, the prison healthcare, and other members of usually what you'd call the MDT. So also in this role, we would act as lead specialists for clinical pharmacy practice. We act as experts on sourcing kind of the best and the most cost-effective treatment. And also we are working with highly complicated individuals. So we ensure that we are liaising with the correct teams and also have our pharmaceutical input on treatment. For example, treating prisoners who are on complex medication like clozapine. Us pharmacists we step into the MDTs, ensuring that the bloods are done correctly. We ensure that the prescriptions are done on time. We ensure the monitoring is done correctly. Again, a highly specialized drug in a highly specialized environment. And also we also ensure the safe and evidence-based cost-effective use of medicines to also maximize the role of pharmacists in prison healthcare. How to explain prison pharmacy is very similar to like a hybrid of hospital, community, and GP pharmacy in one. So that's kind of the most simple way I can put it. And like I said, if you have the passion for patient care, no matter what environment you are in, you can excel. No matter how long you've been qualified, no matter what university you've been to, the passion, the desire, the eagerness, that can take you anywhere. And that's just a brief summary really of prison pharmacy. If you've got any questions, or I'm happy to take them.
Thank you, Emma. So the question we have here, one of them is, are there any managerial issues that arise in your lead roles, and how did you navigate or learn from them?
I think that there'll always be managerial issues no matter where you've been. Usually you get managerial issues such as, we've started a new service. We want to maximize the efficiency of delivering services across different sites, new services coming in, and ensuring that we are delivering them effectively, having the right people in the right places at the right time. And I think no matter where you work, there will always be issues with staffing, HR related issues, rota, holidays, annual leaves. That just comes part and parcel of the job or any managerial roles.
Thank you. And I have a couple of questions.
Sure.
So was it intimidating locuming at first? When you first entered prison pharmacy, did you find it intimidating, or did you see it more as a challenge?
I saw it as an opportunity. I think I worked in a challenging community pharmacy for my pre-reg. I worked in a very, very busy pharmacy, and I was able to handle it. And I was always there to push myself to be the best pharmacist that I could be. So when I went to locum, it was slightly out of my comfort zone, but as soon as you get in, you have confidence in yourself. Everything that you've done, you've probably seen a lot of things, so similar situations to be able to react to. But at the same time, when you started locum, it opened your eyes to a whole different world. But again, it's just a challenge that you just go with, and it's just part of life, really, where you can't just sit comfortable in your own zone and expect it, to develop. It's always good. Well, for me personally, I always push myself to be the best version that I can be. And going into any company, anywhere, any city, any town, any village was not an issue.
Thank you. We have another question, this time in the chat. It says, how are you able to move straight from community pharmacy to a Band 7 role? And what motivated you to apply?
You work in community pharmacy. I think there's sometimes a stigma of it's not a clinical role, it's just a basic, every day is the same. But there's a lot of transferable skills that the community pharmacy can offer, especially if you've locumed, especially if you've worked in all the major chains and the independent companies. And at the same time, we've all passed the GPHC exam. We all have a degree of clinical knowledge, and its application is really down to one's competence. And going into the Band 7, again, like I said to you before, accepting a challenge is just part of who I am. And any opportunity that comes my way, I will take it with both hands and learn as much as I can, apply the knowledge as much as I can, and ensure, like I said, patient safety, patient care is the focus. And if you have that in mind, I think everything else just blossoms in its own time, really. So that's not an issue at all.
Thank you. Another question from me this time. You mentioned substance dependency, substance use, and needle exchange, and how that got you interested in prison pharmacy. Could you expand on that a bit?
Sure. So in the community pharmacy I was working with at the time, there was over 150 methadone patients, we had a lot of needle exchange, and a lot of these patients were in and out of prison. And then being the responsible pharmacist, being the community pharmacist there for a long time, you got to know them on a personal level. You got to find out what their upbringing was like. You got to find out other issues, and sometimes it made you think, is it their fault that they are in this position? So it's more of the sympathetic element of understanding, and if someone's misused drugs and he's on methadone, or he or she is on methadone, it's not for us really to judge, it's for us to help them and support them and kind of be there for them. Sometimes in some community pharmacies, you're probably the only person that they can have a chat to unjudged, and creating that environment was fantastic, really. And it just helped me understand the patient's journey, really.
Thank you. Someone in the Q&A asked, have you experienced any crazy encounters in prison pharmacy?
Crazy encounters? I'm trying to think on the top of my head. I think you not necessarily see it face to face, but you do hear about it, or it gets reported to you. So it's not unusual for prisoners to smuggle in drugs like spice, and for them to completely knock out and experience a near-death experience. And when that happens, the nursing team are usually first on site. Sometimes they might even use a defib. They might send them out to A&E. So drug abuse, illicit substance misuse, drug overdose, I would say it's more or less a daily occurrence in the prison. And for us pharmacists, being able to effectively manage those situations to the best of our abilities, because some drugs, for example spice, there is little knowledge about how it works, what it affects, making decisions whether to appropriately stop medication, halt medication if someone's intoxicated, and how far do you go. So for example, if someone's overdosed on spice, do you stop their insulin? Do you continue their insulin? Do you stop their rivaroxaban? Do you continue the rivaroxaban? So these these conversations are conversations that we have within the healthcare, with the healthcare teams and the medicine management meetings.
It sounds like the multidisciplinary team is very important in prison pharmacy.
Absolutely. The healthcare team is built on physical health, mental health, substance misuse, and pharmacy. All clogs tick together. Each area will obviously have its own expertise. However, there is a lot of overlap, and all teams kind of need to work together. And obviously, as pharmacists, we would lead on the medicines management side of things.
Thank you. We've got another question here, which says, what was the most challenging thing you've experienced in your transition and adaptation to working as a prison pharmacist?
I think maybe just being out of the comfort zone, not being comfortable with certain mental health medication, like I mentioned before, clozapine. Working in the community, you do not see clozapine because it's only initiated by specialists, dispensed by specialist contractors. Whereas when I transitioned into prison pharmacy, we had a couple of people with clozapine. It was a drug I had absolutely no knowledge of, apart from it was very difficult to manage. However, you go out of your way, you do some reading, you ask the consultants, the mental health team, the other pharmacists as well, because there's other pharmacists working in the team, and then you just develop your competence as such. And with experience and knowledge, nothing really becomes difficult to adapt to, really. But I think the most important thing was you know, being able to absorb the knowledge, understand the drug, how it works, what monitoring requirement do you require. So for example, the clozapine, the most essential monitoring that you do are the FBCs. Do they need to are they done weekly? Are they done monthly? If the bloods get sent, we send it to CPMS, for example. When the blood result comes back green, it means continue for another month. If it's red, then you follow a completely different protocol, because obviously there's an issue.
Okay, thank you. And I think our last question we'll take today is there a background story or experience that gave you this approach to seizing opportunities and being the best pharmacist you can be? And is there any advice you would give to pharmacy students with the pharmacy journey?
I just think it's important to, I would always say, keeping your patient and having your patient as your first concern, having that kind of in the forefront of your mind, that really should help you adapt to any industry that you're in, because all your decisions will be made based on patient outcomes as such. And I think it's important for kind of, especially as a young pharmacist coming in, kind of to use that young blood energy, if you like, using that passion and that drive to kind of expect the best from yourself, because we're working in a pharmacy environment. So for example, the community pharmacy that I was part of in the prison environment, where pharmacists can do more. A couple of years ago, it was just the dispensing side of things, but there's so much more that pharmacists can offer. Structured medication reviews, for example. It wasn't a thing a couple of years ago in the prison world. It was just dispense medication, administer medication. Whereas now we're in an exciting time where you can make those developments and kind of pioneer in that field. So I would say there wasn't an experience as such, really. I'm just looking at the question. There wasn't an experience as such that kind of wanted me to be the best pharmacist, but I think it's just a general good outlook to kind of expect the best, because I don't think there's anything impossible, really.
Thank you, Omar, and thank you to everyone who gave in their questions as well. Thank you for speaking tonight. That was very interesting to hear about. Yeah, our next speaker is Emily Kennedy, and just to introduce her, she's been a pharmacy manager, lead locality pharmacist. She's also been a medical writer at NHS Connect, and she's currently the Associate Director at Morph Training, which is a peer-to-peer primary care pharmacy training network. And another interesting fact was she was also a past president of the BPSA. So it's lovely that she can be here tonight.
Thank you, Lillian. And I'm feeling like a very old lady compared to the other speakers, but thank you very much for inviting me. It's great to speak to you about giving you an example of my career, which has been long and varied, and give you a few different aspects which you might want to consider in terms of your pharmacy degree. So actually, I started out, I'm based in Scotland now, but I started out a long way away in Portsmouth, did my first degree there, did a pre-reg at Jimmy's in Leeds, in hospital, and then proceeded to do a PhD in Bradford University. And I was actually the first pharmacy practice PhD funded by the Royal Pharmaceutical Society. So that kind of led me down a route of being really interested in education, academia and training. And subsequent to getting my PhD, I became a teacher practitioner, a Boots teacher practitioner up at there's a very far north of the country in Aberdeen. So I spent 5 years in Aberdeen, which was absolutely brilliant. Loved being a teacher practitioner. I was involved with teaching pharmacy practice. I had supervised a PhD student myself, who helped with pharmacy undergraduate projects, as well as delivering lectures and research on pharmacy practice, and had a great time there. But it was a long way away, and my family are down in England, so we did actually then move down to the very south of Scotland, which is where I still am, and I worked in community pharmacy. So I worked in community pharmacy. I was a Boots manager for about 7 years, until I then decided that I wanted to broaden my horizons a little bit, and got into the health board as a prescribing support pharmacist. So in that role, I started to really promote the role of the pharmacist with GP practices. We advised GPs and other prescribers on their prescribing. We looked at formularies, we developed the formularies, we looked at policies and guidance in lots of aspects of prescribing, and advised any prescriber basically within the area. So within that, I became really interested in, I suppose, well, rekindle my interest in respiratory. My PhD was actually looking at how pharmacists could really intervene and help and improve the care of asthma patients in the community by linking up with GPs and practice nurses. And so I've always maintained my interest in respiratory, but also in pain as well. So pain and respiratory are my kind of specialist areas, but I've still maintained that generalist knowledge. And I think as a pharmacist, we often, although you might be interested, I think we are often very general healthcare advocates and practitioners. And I think it's good to have that, but also maybe some areas of specialism as well. So yes, so respiratory pain became areas of interest, and in Scotland in the last few years, I don't think you'll have any Scottish pharmacists on it, but we have a system. It's quite different to England, but we have a system where we, I suppose, similar to your primary care pharmacists, we have a system called pharmacotherapy. So we now have pharmacists and pharmacy technicians and pharmacy support workers who are looking after any prescribing and medication needs within each general practice. So I now manage that team that offer all those services, as well as maintaining various interests in terms of offering my clinics. I'm an independent prescriber. I do respiratory clinics and pain clinics. I also continue with my formulary work. So we develop the guidance and the guidelines around formulary and guiding what prescribers should be choosing and educating our prescribers. Lots of projects around improving outcomes for patients, and I think what Omar said is really really at the centre of everything. It's looking at what your outcomes are. We're doing this to help improve how patients use their medication and the outcomes that they achieve from medication. And I'd say the pharmacotherapy service in Scotland is all about that medicines reconciliation, medication review, managing acutes, managing repeats, everything associated with medication. So that's been a very challenging but exciting time implementing all of that. And I do that 4 days a week, and then the other day, my other sort of 1 day, and that's, I think, again, an exciting development for a lot of pharmacists. A lot of pharmacists now have what they call a portfolio career. So they maybe have a few different interests. So my main job is my NHS role, but I also do writing for NHS Education Scotland. So that's a NHS Connect. So I write modules for it's problem-based small group learning, and they are multidisciplinary groups that get together and discuss various topics based on the modules that we write. So I write those in a multidisciplinary team. Often, again, I was the first pharmacist writer for that, and they do have a couple of pharmacist writers now, but it's mainly been GPs, but they're expanding as all general practice teams are expanding to include lots more practitioners. So we've got physios now involved, paramedics, advanced nurse practitioners. So it's a multidisciplinary team of writers, and I really enjoy all of that. And we're just going into our first foray of doing podcasts. So I'm going to be involved in the first podcast, and we're doing a wellbeing podcast. So it should be quite interesting. And again, that's about focusing on healthcare well-being, which is very important, because I think we get so engrossed in looking after our patients' well-being, we sometimes don't think about our own well-being. And again, one of my interests in well-being is mindfulness. I am a mindfulness teacher. I trained to become a mindfulness teacher about 5 years ago, and I offer and run mindfulness courses for patients. And my interest in that arose because of pain and because of knowing what issues and problems there are with opiates and analgesics, and that, you know, that there's the misnomer that they are called painkillers, and in fact they don't kill pain. They manage pain when used appropriately, but often you have people with chronic pain and medication isn't the only answer. And I'm very interested in that holistic approach to health, and so mindfulness became something that I was really interested in. Did a mindfulness course myself. You have to practice mindfulness for at least a year before you can become or get onto the mindfulness teaching training course. So I did that, which is a year, and I now have run about 15 courses. During lockdown, we've transferred to offering online courses, which has been brilliant, because where I stay in Scotland, it's the southwest corner of Scotland, but it's a huge geographical area. And actually, to be able to offer these courses online has meant that more patients have got access to it. So that's been a really good beneficial development, if you like, as a result of COVID. I'm also involved, as I said, with Morph. I do train, I'm an associate director, so it's my clock, I'm just going to mute it. It'll chime 7 times, hang on. Just about the last one there. Okay. Yeah, so I do host and help direct the sort of educational content of Morph training sessions, which are available aimed at primary care pharmacists and pharmacy technicians. And again, that's been really good, because you can look at the training needs of pharmacists. We respond to training needs, we develop the educational content, and once you've done your pharmacy degree, your learning won't stop. And in fact, actually, you'll discover lots of areas that you want to know more about. And so there's various educational organisations, and Morph is one of those that will offer tailored education. So I really enjoy that aspect. And as I say, I do a lot of other bits and pieces, consultancy and working to sort of improve patient education and pharmacy education. So, I mean, there's a whole wealth of things that you can get involved with as a pharmacist. So if you're involved in education, if you're interested in training, interested in writing, there's lots of opportunities. And I suppose thinking about the skills that I have got from my pharmacy degree, it's things like, it's that, and both speakers have mentioned that, the transferable skills. It's knowing about that problem solving, improving your communication skills, being aware of, as a pharmacist, I think one of the biggest benefits we have is that being a people person and educating and communicating with your audience, whether that be patients, other prescribers, your multidisciplinary team. And so actually, just learning and exploring your consultation style, your communication skills, your interpersonal relations, is really, really important. Developing those problem solving skills, as I say, and just, you know, being curious. I think just encouraging yourself to be curious, and just really, if something interests you, if you enjoy something, explore that route, because there will be opportunity there for you. So I think you know, you're going to be doing this for a long time. You've got to enjoy what you're doing. So really think about what aspects of pharmacy that you do enjoy, and capitalize on that. So recognize where you are, recognize your where you want to be perhaps, or think about where you want to be, and just look for the opportunities. And somebody said to me once, they use the Aladdin factor. So the Aladdin factor is, if you're interested, just ask. Don't worry, you know, just ask people, because that's how you open doors. But certainly, I think that the pharmacy degree is a really valuable degree to really equip you for a whole range of careers. And there's far more variety available to you than just community and hospital. I've worked in industry, I've worked in academia, and I work largely in primary care, but also in education and training. So a very varied career. Happy to answer any questions. That's just a whistle-stop tour.
Thank you, Emily. So you've got a question here, and anyone who has any more, feel free to put it in the Q&A or the chat. So one of the questions we have is, has being a mindfulness teacher helped you communicate with and support patients in your everyday work? And do these holistic qualifications help you as a pharmacist to support patients outside of chronic pain?
Absolutely. I think it's been, I have to say, it's one of the hardest qualifications I've done. Probably because it required quite a lot of examination and introspection of yourself, and recognition of stresses and strains with yourself. But I think that also has really helped me be a better pharmacist. I think when you talk to patients, you realise there is far more. We often, as pharmacists, think about the medication and the conditions, and I think learning more about mindfulness, you really recognise that you have to look at the person as a whole, and there's so many other influences on a person that affect their health. And so if you've got somebody with stress or anxiety, or the weight of the world on their shoulders, that will impact on their health and how they view their own health, how they view and approach medication. So it's having that holistic view, and I think that mindfulness teaching has definitely helped me, and I can talk to people about being very much grounded in the present moment, being very, you know, sort of trying not to catastrophize, being very aware of their own feelings and thoughts. And it certainly helped me an awful lot. I deal with, again, listening to Omar there, I deal with quite a few patients on methadone, and I talk to them quite a lot about mindfulness, and they've found that really, really helpful. So yeah, definitely a very useful skill to add to my toolkit, if you like.
That's good. Another question I had was, what was it like going into teaching so early in your career?
Well, I loved it, actually, and I think perhaps early on I had maybe thought I would like to be a teacher, and then I discovered pharmacy. And so actually early on I thought combining that teaching and pharmacy was great, but I was a teacher practitioner, so it meant that I still had that foundation of regularly working as a pharmacist, a jobbing pharmacist in a community pharmacy, and I could really bring those real experiences to my teaching. And I worked with some really, really excellent pharmacy lecturers, and I think that between us, it was a team effort. We, you know, I probably had that young, energetic, sort of motivated outlook, but then I had their wisdom, and I think we really, really developed a lot of aspects of the course at Robert Gordon's. And in fact, we were one of the first schools of pharmacy that had the sort of simulated pharmacy experience, and we had, you know, it wasn't all about the old-fashioned dispensing. It was, you know, this is a good wee while ago. It was about sort of focusing on how do we counsel and communicate to patients, and we really developed that. So I think I wouldn't have been able to do it as well had I not had the the support of those really experienced pharmacy lecturers. But I think that's the thing, it is always, you are never as good as an individual. You are, I think you learn to work as a team and gain from that. I think.
Thank you. And what made you get your IP training, your independent prescribing?
Yeah, well, again, I'm old enough to have done the first course in supplementary prescribing, which you may not have heard of, but that was a forerunner to independent prescribing. So I was on the first course of being a supplementary prescriber. And in those days, it was not very easy to utilize. And I knew that I had the knowledge and skills, and I could see the gap and how I could use that. So when independent prescribing came, it was a conversion course for me at the time. I grasped that and jumped onto the first independent prescribing course because I could see that I was making recommendations for treatment for patients, but I was unable to actually complete that journey and do that follow up and have my caseload. And I was always having to get a GP to sign my prescriptions. So the independent prescribing gave me my control and my rollback, and that's why I did that.
That's good. Another question I have here is, what industry roles did you take on as a pharmacist?
Yeah, I was worked in clinical trials, or worked as a clinical trials pharmacist. It was only for a short time whilst I did my PhD, but again, just gave me a real insight and taste of another aspect. So it was a centre where we were basically developing clinical trials, drawing up, and it was very early stage clinical trials. So we were having to draw up the preparations, and it was having the double-blinded treatments prepared and administered. So just very interesting, actually. But it was just a little dabble with industry.
And just bouncing off of that, you mentioned having like a portfolio kind of career. So have you found that kind of difficult, kind of, having juggling so many things at once?
Yes. and I mean, that's why I work 4 days a week in my NHS role, and I have 1 day a week when I can devote to other aspects. I mean, another role that I had was as an e-tutor for Robert Gordon's. I basically did e-tutoring for the postgraduate courses, and I ended up I would spend every evening late nights and burning the midnight oil. So I've cut that back. I'm a visiting lecturer now instead. So I think there is that balance, and it's very important to have that work-life balance. Work hard, play hard, and I think the danger of it's that tricky balance of a portfolio career, ensuring that you do have enough time to do it all and balance and juggle it all. But it does add to the variety and the interest. So it's striking the right balance, as in a lot of aspects of life.
Yeah. And you mentioned that you did medical writing. So what got you into that as well? Well,
I was approached probably as a result of my work with Robert Gordon's to do the Common Clinical Conditions and Minor Ailments course as a distance learning course, and NES and CPPE and the Welsh Postgraduate Education Centre still use that actually. So I did that, and as a result of doing that, that does sort of open again the doors to writing. I've always enjoyed writing. Again, I think if you look at topics and aspects that you enjoy, I've always enjoyed reading, writing, and so utilising that in my pharmacy career has been really enjoyable. So building those connections with NHS Education Scotland through writing that Common Clinical Conditions course, when they were looking for a pharmacist author, they approached me because they knew I was interested in writing, and that's developed, and I've written quite a few modules now, which I thoroughly enjoyed, and then that's expanded to other articles and writing blogs, etc. So yeah, just again doing what you enjoy, and then that you can't go far wrong.
Thank you. My final question was, you mentioned that you had to maintain your general knowledge as you were, progressing in your role. So How do you think you've done that?
Yeah, well, again, don't think you ever stop learning as a pharmacist, and attending. I mean, webinars have opened up a lot more, but we have our postgraduate education courses that are offered through NHS Education Scotland and a CPP. So you can do that lots of ways, either by distance learning, but also by in-person courses pre-COVID, and basically attending all of those. But you look at your learning needs, and when you're encountering a new conundrum, a new clinical problem, or you do something like, I need to do some education on that, or new biologics or new drugs coming along, or new ways of using them. I'm doing COVID medicines for instance at the moment. I am part of the senior COVID medicines triage team in Dumfries and Galloway. So any patients who are high risk come through the triage team. I'm one of 3 pharmacists and 3 medics that decide what patients get. So again, because I've been asked to do that, I had to go away and do a bit of reading, making sure I've updated myself with all the relevant clinical knowledge. And you'll always have that, throughout your career as a pharmacist, you will always identify the gaps in knowledge. And I think part of the art in knowing and educating yourself as a pharmacist is knowing where to go to find out that information.
Thank you, Emily. And thank you so much to all of our speakers for tonight. I think we'll just end here. If there's no other questions, I don't think there are any. Thank you again, and thank you everyone for attending. I hope you enjoyed and learned a lot more about the alternative careers in pharmacy, and I hope you all have a good night. Thank you.
Thank you. Good night.